Taoiseach. Deputy Palmer.
Look, I plan to ask a question, answer, and so on. Just to the point, Taoiseach, do you agree with Dr. Jack Lambert that we have a national emergency in our nursing homes? Do you agree with him that leaving the individual private nursing homes to be responsible for staffing regimes, infection control and supply of PPE, as the HSE guidelines have done, was, quote, a huge disaster? Do you agree, Taoiseach, that that's part of a process of privatisation, of not having the nursing homes as part of a national health service, and the agency staff underpaid, living in overcrowded accommodation, working in multiple homes is a factor in that? And finally, Taoiseach, will you agree that the government should provide a procedure for workers in residential care facilities to confidentially report breaches of HSE guidelines to HICWA? Do you agree that the HSE guidelines should be augmented so that staff are not living in overcrowded accommodation and are not rotating between different residential care facilities?
Yeah, thanks very much. I just didn't have time to jot down all the Deputy's questions, so but please do repeat them if I missed them. Do I agree that the coronavirus is an emergency? Absolutely. It's a national emergency. The government declared the emergency some time ago, and that emergency exists not just in nursing homes and care homes, it exists in hospitals and exists in the community as well. It's a health emergency, it's an economic emergency, it could yet become a fiscal emergency. So yes, I absolutely agree that, but I don't think the emergency is confined just to nursing homes. I think it is a wider emergency than that. In relation to our nursing homes in Ireland, as is the case in most countries, as has been the case in Ireland always, we have a mix of nursing homes. Some are provided directly by the HSE, some are voluntary, some are private for-profit nursing homes. I've yet to see any evidence that indicates that the number of cases or proportion of cases in nursing homes that are private versus public is higher, or vice versa, or that the number of deaths per population in private versus public is higher or lower. So I know people have views on this, but I'd like to base views and opinions on facts, and I've yet to see any facts that shows that the private or public ones are performing better or worse than each other in terms of the number of cases or the number of deaths. And I think, again, I would ask people not to jump to those kind of conclusions if the facts aren't there, and also to be responsible in their commentary, because, as I said earlier, there are lots of people in nursing homes, in care homes, who are terrified about getting the virus, and lots of people who are relatives and friends who are worried for them, and we should make sure that what we do and say is entirely fact-based.
Hold on, Deputy.
Homes responsible for staffing regimes, infection control and supply of PPE, as the HSE guidelines have done, was, quote, a huge disaster. Do you agree with that or not?
Thanks, Deputy.
Thanks, Deputy. I can't give you a straight answer to that, because I don't know if that's correct. You know, I'd have to check the HSE guidelines. I'm not sure if it's actually correct that assertion is factually true. It may be correct, but I'd have to check as to whether it was left to nursing homes to provide their own PPE. My understanding is that HSE has been providing PPE to private nursing homes. My understanding is that there are regulations around staffing schedules, and they're HICWA regulations, not HSE ones. But I would honestly have to check as to whether those assertions are true or not before I could say whether I agree or not.
The deal with the private hospitals. It's reported in a newspaper today that the estimated monthly cost of the leasing of private hospitals will be €115 million. Is that accurate? Again, a simple yes-no answer, not a kicking to something's going to be published at some time. Is it accurate that €115 million will be given a month to private hospitals? If it is accurate, is there a profit margin built into that? In other words, are some people going to get rich off of dealing with this massive health emergency?
Thanks, Deputy. That's an estimate, so it's as accurate as any estimate can be. If that answers your question, it may be right or may be wrong, but it's an accurate estimate. It's not necessarily what the accurate cost will be, because we won't know that until the end, because the costs obviously have to be calculated. But the agreement that was made between the HSE and the Private Hospital Association was done that this will be done on a not-for-profit basis, so it's the covering of the costs of the hospitals.
I think, Deputy.
Yeah, the Taoiseach himself on St Patrick's Day said that the bill will be enormous. That's a bill for the immediate health costs. It's also a bill for the economic consequences that flow from that. Obviously, a key question that is going to be posed is who is going to pay that bill. The attitude of the government and what's happened so far is not particularly hopeful when you look at the clear approval of the change by revenue of the rules in terms of tax exiles, so they're not discommoded by the coronavirus crisis. They're able to continue in that status. But the question I'll ask just very simply is, will the government drop its appeal about the Apple tax ruling? Will it instead seek to access some or all of the 14.3 billion euros in an escrow account and use it in terms of this crisis? And finally, just to repeat a question that Deputy Boyd Barrett asked earlier, why on earth are Ernst & Young, now called EY, formerly auditors of Anglo-Irish Bank, why on earth are they being involved in the drafting of a plan about coming back to, quote, business as usual?
Thanks, Deputy. Taoiseach, you have a minute.
Thanks, Deputy. Your answer in relation to Apple, the answer is no, and I think it's a very disingenuous question and solution. The truth is, whether the state withdraws its appeal or not is irrelevant. Apple is appealing this judgment as well, so this will continue to be a matter for the courts for many years, no matter what the government does. And secondly, the money has been collected, but it's in an escrow account that is controlled by the Bank of New York Mellon. No government of any colour, of any party, led by anyone, would have access to that escrow account, which is controlled by Bank of New York Mellon. And those who are claiming that there is some mechanism by which we could access those billions is just being entirely disingenuous, and the public deserve better than fake solutions from people. I think, sorry, I missed your second. Sorry, Ernst & Young. Yeah, I'll have to come back to you again on the details of that. My understanding is somebody who works for Ernst & Young has been retained by the HSE. I forget her name. Somebody has been retained by the HSE as a project manager. The view that the CEO of the HSE took, Paul Reid, was that we were asking the scientists and the lab managers to do too much. We're asking the same person, Killian de Gascoigne, Professor de Gascoigne, a great man who runs the NVRL, the National Virus Reference Lab, to at the same time project manage the ramping up of testing across the entire country. You can only ask one person to do so much, so an experienced project manager was brought in from the outside to do it, and that's how that came about.